It's not exactly Rosie from the Jetsons, but robots are making their way into surgical rooms. We'll find out more about that next. Today on Moms Everyday, we are in Denison at Cernero Surgery talking with Dr. Cernero about what is relatively new when it comes to surgery, and that is robotic surgery. How exactly does this work? It's not a robot working alone. You're behind the controls.
No, it's really robotic assistance. We're controlling the robot at all times. We're always in the room. We're always right next to the patient. So we've eased a lot of minds by giving them that information.
And it's not like you're programming the robot to do something. You are doing the maneuver.
We're actually controlling it ourselves with small instruments. We're controlling the robot at all times. It's not pre-programmed.
What are the benefits of using a robot?
Well, there's multiple ones. For the surgeon, we can see a lot better because we have 10 times magnification as well as 3D optics. For the patient, it's smaller incisions, less pain, quicker recoveries, less hospital stay, and back to work a lot quicker.
Okay, and you did say less pain. I want to make sure there.
Yes, less pain. Smaller incisions usually equals less pain.
What kind of surgeries is this used for?
Across the United States, it's used for all different types of surgery. For my practice, it's used for hernia repairs, colon resections, and hiatal hernia repairs.
Okay. Are all robots created equal, or are there different robots created for different types of surgeries?
There's one robot. It's called the Da Vinci, made by Intuitive Surgical, and it's just used for different purposes, but typically the same instruments, but just different physicians using it for different purposes.
Okay, and I'm guessing that not all surgeons are qualified to use the robots. You have to go through training for this?
Yes, there is a certification and training that is performed by the surgeon and also with the company Intuitive Surgical, typically at an off-site like in Houston area.
If I'm your patient and I'm thinking, oh, I'm not so sure about the robot thing because it's electronic, maybe things could go wrong, whereas your hands are your hands, what are you going to tell me?
Well, the robot's always controlled by the surgeon. There's always safety that's involved in it. We can remove the robot at any time during the operation and go back to standard surgical techniques like laparoscopic or even open. Mm-hmm. So the surgeon's always there to make sure everything goes safely.
Okay, so you give it the thumbs up for everybody?
My patients have given it the thumbs up,
okay.
And what they've said after they've had the operation, that their pain is much less.
Okay. So, but everybody would be a candidate for this? It's not just good for some patients versus others?
Of course, just like everything in medicine, you must talk to your physician about who is a candidate, who is not, and that's what I'm there for.
All right. Dr. Cernero, thank you for the information. I'm Ellen Sacco. Be sure to check out our website, momseveryday.com/Texoma.